Bismillahirrahmanirrahim. Assalamu alaikum. A 32-year-old woman come to the office for evaluation of abnormal uterine bleeding. The patient had a vaginal delivery 4 months ago, and she has had a menstrual period since she has not had a menstrual period since the delivery. Her postpartum course was complicated by a postpartum hemorrhage requiring blood transfusion and emergency suction and sharp curretage. At her postpartum visit 2 months ago, the patient was starting on combination oral contraceptive and has no vaginal bleeding or spotting during her week of placebo pills. Prior to this pregnancy, she had regular monthly menstrual cycle with 3 to 4 days of moderate bleeding. The patient has had increasing fatigue since returning to work and is bottle feeding due to low milk supply, but she has no headache, galactorrhea, or hot flashes. Vital signs are normal. BMI 31 kg. Pelvic examination show clear vaginal discharge throughout the vault and a well-rugged vagina. The uterus is small and intubated, and there are bilateral small non-tender uterus. Ovaries. Urine pregnancy test is negative. FSH and TSH are normal. Which of the following is the most likely diagnosis in this patient? So this patient is a 32-year-old woman. She came to the office for evaluation of abnormal uterine bleeding. The patient had a vaginal delivery, and she has not had a menstrual period since the delivery. Her postpartum course was complicated by postpartum hemorrhage, which required blood transfusion, and emergency suction and sharp curretage was done. The patient was started on oral contraceptive pill, and she has not had a vaginal bleeding or spotting during her week of placebo pills. Patient pregnancy test is negative, and her FSH and TSH level are also normal. Based on this, hence the diagnosis of this question is choice A, Asherman syndrome, which has intrauterine adhesion, the complication of septic abortion, endometritis, or surgery, for example, the sharp curretage, and the patient sharp curretage. So this patient has Asherman syndrome, which is the formation of intrauterine adhesion. Risk factor include infection, for example, septic abortion, endometritis, intrauterine surgery, for example, curretage, myomectomy. Clinical feature include abnormal uterine bleeding, amenorrhea, infertility, cyclic pelvic pain, recurrent pregnancy loss, and it's evaluated by hysteroscopy, which can analyze the adhesion. Come to the incorrect one. Choice B, gestational trophoblastic disease. So patient having gestational trophoblastic disease, which is choriocarcinoma, patient will present with abnormal uterine bleeding, but patient will have elevated beta HCG level. This patient has normal negative pregnancy test, making this diagnosis unlikely. Choice C, polycystic ovarian syndrome. So patient with PCOS, which is polycystic ovarian syndrome, have abnormal uterine bleeding, but the patient typically will have obese, her BMI will be raised, and she will have hirsutism with multiple cystic ovary on ultrasound. Choice D, postpartum thyroiditis. So patient with postpartum thyroiditis is an autoimmune transient thyroid disease that can occur within an year after the delivery, and patient will have abnormal uterine bleeding, but patient will also have the abnormal TSH level. This patient having the normal TSH level, making this diagnosis unlikely. Choice E, primary ovarian insufficiency. So patient having primary ovarian insufficiency will have abnormal uterine bleeding, but her FSH and LH level will be also abnormal. This patient having normal FSH level, making this diagnosis unlikely. Choice F, Sheehan syndrome. So patient having Sheehan syndrome, for example, postpartum hemorrhage, which will cause a hypoperfusion to the pituitary gland. Patient will have abnormal uterine bleeding. Patient does not have lactation. So this patient having the normal TSH and FSH level, making this diagnosis unlikely. Sheehan syndrome.